We're so grateful that you're here. It's Wednesday, February 3rd, 2021, and we're talking about how we can prepare our congregations and the people we love to be able to start serving other people, especially with food ministries. And it's a great partnership between the Interfaith Sustainable Food Collaborative and the Interfaith Council of Contra Costa County. We'll be making this recording available for others in other parts of the Bay Area that are working with the Interfaith Sustainable Food Collaborative. And we hope that everything we share tonight is correct to the best of our knowledge and also helpful for you in helping your congregation get back to being able to serve once our vaccines are efficacious. But we thought now would be a good time for us to start thinking because of how we might be able to get back together because of the amount of food insecurity that's going on across the whole Bay Area and our whole state. And that it might take us a little longer to get that vaccine shared as much as possible. So we're so grateful that you're here. Want to introduce Steve Schwartz from Interfaith Food. You want to give us a brief welcome?
It's great to be here. We love the Interfaith Council of Contra Costa County, and we're really impressed by the what we heard last month at the event that we'll put together, and we're glad we're doing this today. And my new coworker Isai is actually ready to tell more about Interfaith Food. To introduce the organization for a couple minutes.
Yeah, sure. Thank you, Steve. Appreciate it. It's a pleasure to be here with you all. As the new guy, it's good to just connect with partners and constituents, even if it is through a computer. I hope you're all doing well tonight. And as you all know, this workshop is about food safety during COVID. However, I also want to give a broad background about what we do. So here, we at Interfaith Food focus on the food access and production and empowering faith communities to have an impact on local food systems and advancing public policy as well. If you visit our website, interfaithfood.org, you will find what we like to call our menu of options that outlines the ways faith communities can become partners with us. So if any of you is interested in an appetizer, perhaps, that gives you just a taste of what working with us looks like, you might be interested in gleaning with one of our farm partners. Or if you're ready for an entree, perhaps creating a community garden in your property or joining community-supported agriculture or CSA sounds more appealing. Or maybe you've been a veteran in the sustainable agriculture community for a while and you just want that last dessert cherry on top. You could serve local fair trade products after your service if you want to go that route. So if we have ample opportunities for you to partner with us, and we will be glad to help you and guide you through any sort of partnership that you want with us. So we usually speak about sustainability with our partners, we often imagine a three-legged stool. The first one is environmental sustainability. The second is economic viability. And the third one is social justice. While there has been significant growth and awareness in the social justice aspect of sustainability, we feel that in the sustainable agriculture community, the social justice leg of our stool has been the weakest so far. So we help address this through our CSA partnerships that connect faith and secular communities, and by advocating for BIPOC farmers and workers, as we did last year in November, supporting the California Rural Legal Assistance Foundation policy brief to include farm workers in the highest tier of distribution for COVID vaccination. We believe that there are many ways for all of us to contribute in making sustainable agriculture stable and sturdy for future generations. Next slide, please. As I mentioned already, we want to empower faith communities to effect change in local food systems. And one of the ways we do that is by facilitating partnerships between them and local farmers through community sustained agriculture, or CSAs for short. CSAs allow faith communities to share some of the financial risk local farms have by becoming subscribers of a farm's weekly produce box. This commitment upfront gives faith community members the opportunity to help finance planting, and fund other expenses in the early season. Other ways faith communities share this risk is by learning about the seasonal aspect of eating and farming and receiving newsletters that usually provides more information about new products that might be available or give new recipes. There really is no need to have every single member in your faith community become a member or sign up. Usually 10 to 12 people is enough to provide support. Next slide, please. Oh, excuse me, yeah, can you go back to the prior one? Thank you, sorry about that. The second way we empower faith communities is through kitchen leasing. And kitchen leasing usually involves faith communities opening up their kitchen facilities to micro food entrepreneurs. And this allows micro food businesses to prepare low-risk food products in a more suitable commercial kitchen, which helps them comply with county regulations regarding food preparation that might be instantiated at the moment. During our time of COVID, these businesses have shifted a bit, shifted gears and adapted to include other services such as delivery or pickup in a socially distanced way. As with every other business, they've had to adapt as well. Next slide, please. There you go. If any of you is interested in partnering with us by creating a CSA, leasing out your kitchen, joining us for food justice and sustainability advocacy, please contact us. We'll be happy to join you and have you be a partner with us. Our business email is info@interfaithfood.org, and our phone number is 707-634-4672. And also to stay in contact with us, we also have a monthly newsletter we publish with our latest news and updates. And if you would like to sign up for that, please go to our website. Our website has a link there for you to sign up. You could find it under the news dropdown. We look forward to talking with you all and helping you become involved in the sustainable agriculture movement. Thank you very much.
Will, I see you're muted. I don't know if you're waiting for me. Are there any questions for Isai or questions about Interfaith Food, or should we move on down the agenda?
Yeah, questions and answer time is good. And then is iCare next?
Yeah, that's exactly.
Great. Chiquita, any questions? Judith? We're
No,
none
sorry.
then. All right. Great. So okay, I'm Will McGarvey, the Executive Director of the Interfaith Council, and this last summer we started a new program we called iCare, Interfaith Community Action Revitalization, and Greg Kremenliev is our iCare coordinator, and he's going to give us a presentation and an overview of how this works to help create the interfaith service teams that are really just starting to come into their own right now. Greg?
Okay, thank you, Will, and I have had the pleasure and the blessing of being on board with the iCare program since November 1st, and have been really excited by the spirit of cooperation and communication amongst the different faiths. And Will, do we have are you going to control the slides and kind of move them forward? Do we need can I do that?
Just tell me slide.
Okay, how about next slide? Okay, so the way that iCare works is that we identify a project with a nonprofit partner, and then we recruit two congregational co-sponsors, and we then opened the project up to the Interfaith Council members. And so once a project has been launched, then anyone in the interfaith community can sign up to volunteer. The co-sponsors, of course, do take primary responsibility for recruiting volunteers, and some, of course, do a better job than others. And yeah, I think that's, let's go to the next one. That's, okay, so what we have, and I don't know if any of you are familiar with the Sign Up Genius, but it's a very cool way in real time to organize projects and to help sign up specific volunteers. And I guess I think this link will probably work. There's a link on here to the Sign Up Genius, which you want to go to the next one, Will? There it is. There it is. Is there a way to put that in the chat, possibly? Which would be great. And then let's go to the next slide. Okay. Since we began in August, we've done some really very wonderful programs that are listed here. 1,500 hygiene kits and 250 food kits for the Contra Costa Health Department. Thanksgiving fixings for the Monument Crisis Center. Over 600 breakfast bags for the Trinity Center. And a current project that's interviewing skills support and informational interviews with job seekers for Opportunity Junction. And I'm sure a lot of you are familiar with the nonprofits that are listed here. They're wonderful community partners, and they're extremely thankful for the support we've been able to offer. Next. And okay, these are the projects that we currently have we need volunteers for, and I'm going to on the Trinity Center breakfast bags, that is going to be either the 22nd of March or the 29th of March, and that is a project that we're currently looking for 2 co-sponsors on. So any communities that are interested, we'd love you to do that. Very cool project that we just put together with the Monument Crisis Center, celebrating Mother's Day, and it's hygiene kits for women, diapers, wipes, and then a donation to take advantage of the Monument Center's buying power for food. And that is set up on the 13th of April. And that one does have, that is a primary sponsor in Temple Isaiah, but is seeking co-sponsor. And then the Habitat for Humanity is still, we don't have a specific date for that. And the next. That's okay. There's again, that's just that's how the Sign Up Genius looks. We don't need to go into any more detail on this. And is there, are we getting is that the last slide, or are there a couple more? Okay. This is, we've gotten wonderful feedback from the nonprofit partners. The Opportunity Junction, you all can read that, but they were quite pleased. The screenshot is those who participated, the volunteers. Okay, next. To keep that, we don't have actually the audio for that.
Hi, this is Dave Longhurst, and I would like to share a wonderful experience that I had yesterday. I was able to participate in mock interviews with several other volunteers. We volunteers were recruited from 2 faith congregations in the San Ramon Valley, St. Isidore's Catholic Church and the Church of Jesus Christ of Latter-day Saints. Our 2 congregations were brought together by iCare, an initiative of the Interfaith Council of Contra Costa County, which encourages interfaith cooperation and community service. We joined together in support of Opportunity Junction, a not-for-profit entity that helps low-income residents in Contra Costa County prepare to obtain full-time employment. And I have to say, it was an absolute delight to meet with 3 wonderful job candidates. each who were very focused on developing the skills needed to obtain and retain a good paying job. I was able to provide encouragement and feedback, which they seemed to deeply appreciate. All in all, it was a wonderful way to spend a couple of hours.
You're on mute.
Sorry about that. Yeah, some of our volunteers in action at I'm not sure which that might be a food distribution, I believe, project.
I think
but
that was Saturday at Christ the King, putting together
Oh.
the food kits for the core teams.
That's right. Okay, thanks, Will. I appreciate that.
That's Christ the King's big tent. They have a big outdoor tent that they're using for worship.
Okay, yeah, that was a wonderful project. Do we? And then care notes is something that people that don't want to go out and interact with the public during COVID times can do as a just a kind gesture to put with the packages of food and hygiene items. Next. I think that this really summarizes what we do, and I appreciate people's attentiveness here. But we do make a difference in the community. We've been focused and are beginning to have many more food projects. When the faith communities sit down and work together on a project, it's to me amazing, especially in these tough times we have in the country. It's a great way to just to communicate, and also, of course, in the process, you learn about your own faith. So I think that's pretty much. Unless is there one more slide, Will?
I have one more here, and this is for me, basically a reminder that if you're going to continue with this series, there's one meeting tonight and another meeting on March 3rd, where we're going to talk about pandemic EBTs and how congregations can start helping with that in some new ways. And so you register once for both uses. So please save the URL, copy and paste it into a Word document or something, or into your calendar so that you have it for Wednesday, March 3rd. And we're going to have another follow-up program like this as well.
Okay, thank you.
Thank you, Greg. So food safety, or is it the introduction to interfaith food?
Food safety. We at ESA covered all we need to on intro to interfaith food.
Great. Then we're going to start moving into food safety, and we're Greg. Please meet Claudia Ramirez, who we are going to want to do an eye care project with to get some volunteers for a special project at St. Vincent de Paul, and we'll hear more from Claudia soon.
Definitely.
Wonderful.
Thank you.
Laura?
You're muted, Laura. Laura, you're muted.
Yes, I'm getting it together right now. I think it was still on presentation mode from before. Can everybody see my screen? Okay, great. All right, Stephanie.
Hi, everyone. Thank you for joining us tonight. My name is Stephanie, and I'm here with my colleague, Laura, and we are both outreach program assistants for Interfaith Sustainable Food Collaborative. So why are we talking about food safety? This is relevant if you have a pantry, participate in community-supported agriculture, or are a part of a food box distribution project. This is also relevant for faith-based groups getting ready to step up after reopening, and as a part of the post-vaccination county distribution. We still want to take precautions while the vaccines are being rolled out. and as new shelter-in-place orders are being lifted. Just a quick disclaimer that Laura and I are not public health officials, and to please check in with your county and with the CDC for specific guidelines regarding proper procedures. And this presentation specifically is on safe serving practices and some general reminders that we wanted to highlight for organizations that are distributing food. Next slide, please. So some precautions to take for yourself. The biggest ones that we'd like to highlight would be to wear a mask and maintain social distancing. It is recommended from health officials to wash your hands every 2 hours, avoid touching your face, and one of the biggest ones is to stay home if you are showing symptoms or if you feel sick. If you are in a space with other people, and also just generally to cover your coughs and sneezes and wash your hands after that happens. Temperature checks are also some things that organizations have required staff and volunteers to do. And as different groups are able to be eligible for vaccinations, it is recommended to get vaccinated. Just a general reminder that some COVID symptoms include fever, cough, difficulty breathing, fatigue, loss of taste and smell, among others, and that COVID symptoms could show up 2 to 14 days after initial exposure. So you want to make sure that you are cautious of that as well.
Some precautions that your site can take is providing signs that detail social distancing requirements, such as wearing a mask, 6 feet apart, signs that say stay home when you're sick, and labeling the sanitation station. Providing these signs in multiple languages will help, keep our broader community informed. You may also need to update the layout of your site to comply with these social distancing measures. That may include including barriers or marking the floor for 6 feet apart. You'll want to wipe down frequently used surfaces, such as tables and doorknobs. Pickup options that are good for complying with social distancing measures is drive-through, curbside pickup, appointment only, outdoor distribution, and expanding your hours. All of these can help reduce the amount of people in one space at one given time so we don't spread COVID. And then also providing hand sanitizer and mask at the entrance for staff and recipients is really helpful, as well as providing health screenings, such as what Stephanie said, taking temperature, asking questions like, have you been in contact with anyone with COVID? Or what if you have any symptoms, and getting contact information to conduct contact tracing.
Some general packaging precautions we want to highlight that are pretty general depending on what type of food distribution you do. The biggest one is to make sure that you keep packaging items away from the main operation base. So for example, if you are collecting donations or receiving a donation, you want to make sure that you are packaging these items in a separate location than where you are receiving the items. And you want to make sure that the people who are doing the packaging keep up with the proper cleaning and sanitation. For example, washing your hands before and after packaging, wearing a mask as shown in this picture here. You want to limit the risk of contamination, and you want to limit the amount of contamination that could be spread on the actual packaging itself. And just a general reminder, once the food is packaged, it should be kept closed upon arrival to the clients, whether that's a takeout box or bags as shown here. The only people who should be opening the package is the recipient of the package, and that will also limit contamination as well.
A requirement and recommendation is to use single-use gloves when handling ready-to-eat food. You'll want to wash your hands before placing the gloves on your hands, and touch the gloves as little as possible and by the opening of the glove. Once you have your gloves on, check for rips and tears, and you'll need to change your gloves periodically when they're contaminated, torn or dirty, when you start a new task, or interrupted during a task, such as answering your phone. Switching from raw to ready to eat food, and after 4 hours of continued use on one given task. All these can help prevent contamination.
Specifically for delivery reminders, the biggest thing to highlight is to wear a mask and socially distance as much as possible. Some organizations have let their clients know of specific delivery windows or have done a no contact delivery system where they give the client the window where they would be delivering, and they leave the items outside this client's stores. You want to make sure that the people who are doing the deliveries are washing their hands before and after each delivery to reduce the risk of contamination. And if they do not have access to hot water and soap, it is recommended to use a hand sanitizer that has at least a 60% alcohol value. Something that is sometimes forgotten is that vehicles, coolers, and insulated bags need to be cleaned and sanitized. It's recommended from health professionals approximately every 4 hours upon ongoing use, again, especially if you're doing multiple deliveries, to limit the risk of contamination. And if an organization has a shared vehicle, you want to make sure that the vehicle is clean before and after each new delivery driver. Whatever vehicle is doing delivery should be cleaned daily, but especially if there's going to be multiple drivers in the same space. It is also recommended that with multiple drivers or multiple deliverants, that masks should be worn inside the vehicles at all times to limit the risk of contamination, and also to open windows to increase the ventilation within the vehicle as well.
Takeout reminders, pretty much the same as delivery and all the other site guidance. You're going to want to clean and sanitize high traffic areas. Curbside pickup is a good option to be socially distant. And when you are packaging food, using utensils and gloves when directly handling the food. And if you are coming in direct contact with anyone when handing off this food, you'll want to change your gloves or wash and sanitize your hands. A good option to maintain social distancing with takeout is having either a table or like a basket when you're handing off the food, so that it reduces the amount of direct contact you have with recipients.
These are some resources that we would like to highlight. The CDC does have considerations for communities of faith and for food pantries and food distribution sites. In Contra Costa County specifically, there is a COVID-19 interim guidance for retail food facilities. There are some resources on specific cleaning guidances after a confirmed COVID-19 case. And the restaurant certification group SafeServe also offers various certifications for organizations, including some free COVID-19 based resources, and also some different certifications for various prices as well. And we do plan on sending out these resources and the links that go along with them in an email after this presentation.
And that concludes our presentation. If y'all have any questions, feel free to ask them right now. Otherwise, we'll hand it over to Will. Okay, looks like no one has any questions.
Thank you.
Thank you.
So the county sent us this form letter. And it's a reminder, based on some of the other programs that we've done in the past, that when congregations do food, their charitable status gives them a couple different options in the way that they do that, if they're making the food for their congregation. But the food distribution and even the food preparation still needs to occur by the county's rules. So we, I'll put this document in our chat room, but it's basically this interim guidance on charitable food distribution events is important because they want us to be able to share whatever food ministries that we have safely and without safely, both with the food and with not spreading COVID-19 and according to those COVID-19 safety requirements. If you have any questions about what the county's health ordinances are, you can find those at www.coronavirus.cchealth.org. And there's, of course, there's still all of the food preparation information like we've heard from Laura and Stephanie tonight, but you have to be really careful with the distribution and whether you're opening your own site and people are coming to you, creating little tapes on the ground so that people know the spacing to be away from each other so that they can be in compliance with the COVID-19 safety rules as well. And when I post this on Facebook, or I mean on YouTube, I'll put a link to this as well. So maybe we could do the faith-based panel, unless you, Steve, did you want to do anything more with scenarios or anything, or AB 2178?
Let's go forward, unless well, on the bill, Will, I want to say, do you want to say anything about the bill? Because I think you might know more about it than me still. But either way, we could go on to the panel. That's fine too.
Why don't you say something about the bill quickly, and then we'll do the panel. And then if there's any other questions, we can wrap up, because I think we're a little bit ahead of our schedule.
Yeah. Well, you know, I probably, most people on the Zoom know that there was an incident a few years back where some potluck at a church and a food safety issue happened, tragedy. And, you know, that led to some legislation to clarify, you know, what is okay and what's not okay. And I'll say one of the things that we know is that, well, I'll just leave it at that. And if there's further questions or add-ons, please do. But I'm not ready to say more about that bill right now. But
All right.
what
Well,
I do want to say is,
I'll just point out that in the, you know, the state bill and the state bill that first came out in response to the person who died from undercooked turkey at a Thanksgiving potluck in East Contra Costa County felt really draconian, and a lot of different counties in California wrote back and said, you didn't need to go this far, but you were missing this. So they amended the law the next year, and it's back to a more moderate position, and it encourages congregations to be able to have all of the food events when there's not the COVID restrictions, but it really allows an opportunity for congregations to go through a process of getting their own kitchens inspected and either registered or inspected. And if you have a commercial kitchen, you have an opportunity to lease that out to caterers and other folks that are making homemade, or what, you know, some caterers use their home and they have to get a special permit to be able to use their home. they're trying not to allow for that right now with COVID-19. But if you have an empty congregational space and you can lease it to, and it's a fully up to code kitchen, you can lease it to some of the caterers who are trying to do the food preparation and distribution safely, if they, as long as they have a safe commercial kitchen. So it is an opportunity for some congregations whose space is unused right now, for them to allow just the caterer to use their kitchen space, maybe not do distribution to it or through it, but be able to take their wares and deliver it to their customers. And we know with the number of restaurants that have been closing these days, any help to the food industry is help to our communities and the families that live nearby. So we want to just make sure that we're good neighbors. And if we do have some of those spaces that might be good, advertising about it and maybe helping some of the struggling restaurants that may or may not have their space anymore, rent a space could help keep a business in going. So let's leave it there.
Yeah, and I'll piggyback on that, Will, to say, I'll tell you a little story. I was I visited a family a couple of years back, and they're in a small apartment in affordable housing. Mom was making tamales, and she sells them in her apartment complex and sometimes elsewhere. And that's a significant part of that family's income. Actually, her husband was a farm worker who had a disability at the time. So it was a major part of the family's income, but she could not, legally sell those in different, at stores. She could sell it in pushcart and with her friends, but, and frankly, she had a very small apartment, and the living room to the kitchen was about, 30 inches apart, and she had a couple of young kids. One of them was sniffling. This is pre-COVID, but I think you get the picture, that the more, when a church or other congregation has a commercial kitchen and let somebody like that, grow a food business and be able to sell it in a permanent way and be able to sell it at local markets, that can make a huge difference in a family's income. So it's another piece of social justice side. And of course, like as Will said, even though there are options to do pre-COVID to do some of it legally at home on a small scale, at a larger scale and in a safer way, we want to work with congregational kitchens. And we know some congregations are making that available for free, and some are charging. Some are making a little money on it, and it's still a bargain for the customers.
And the thing I'll just mention, Steve, is that our county is basically saying that nobody can use their home kitchen. There's no permits being given right now for that during COVID because of COVID. You would have to rent a place like a congregation to be able to do that.
Yeah. So, and for a congregation that's a resource that costs a lot of money to build, and it's not being used. Maybe before it was being used 1 day a week or 2 days a week. Now it might be being used 0 days a week, right? And you can rent it out, hey, you can rent it out for 4 hours here, 3 hours there, and have a little agreement with some, and we're interested in helping congregations want to do that, make sure they have a, liability protection, and help them with an agreement so that they feel protected too.
All right.
So if you're interested in that, let's talk more.
Yeah. You can talk to Steve or I, and we can help get you connected to the folks that have any other things. All right. There's more presentation. And then Claudia is going to be ready to present next. Oh, I can pin you both and put you both on the screen too, if you'd like. Oh. But Claudia, why don't you have a brief presentation to show folks in your setting, which is different at St. Vincent de Paul. Why don't you do, let's let loose the share screen and let Claudia bring her presentation up first, and then we'll have Steve and Claudia share some of the best practices.
Okay, great. So, thank you, Will, for inviting me to present this evening. It was interesting as Laura and Stephanie were going through the guidelines and everything. I've got examples and stories of pretty much all of those different things and how they've been in play. So we is what I hate about the screen share here. It's not. There we go. So, you know, just a reminder of who we are. We really, we've always built our relationships with our neighbors in need, with those that we help. And that's been the hardest part during all of COVID, is having to find ways to maintain those relationships and not becoming just transactional. And I've been really proud of how our volunteers have done that, including in the way that they've done the food pantries. So we have at our Family Resource Center, which is our main office in Pittsburgh, we've got emergency food. Basically, it's a 3-day supply of non-perishables, but now we've added also proteins that we can get through the food bank. And we do that for somebody once a month. And all they need to do is prove that they're a Contra Costa County resident. And how we're doing that at our offices there, we have big glass doors at our main entrance. So we have a podium set up on the inside where we have the book where we log all the pertinent data that we need to collect for the food bank. And we just have them put their ID up on the window. And then we ask them to step back. We've got it marked, you know, about 6 feet from the door. And then we've got 6-foot markings after that. And, you know, it's nothing fancy. It's blue duct tape because it's our property. So we're doing duct tape. When it's on public sidewalks, we do painter's tape because it's easier to lift off. But we do that. And then we'll go in, pull whatever food for the size of the family and everything, open our glass door, set the food outside, close the door, and then let the person come up and walk to get it. So we package all the food in the food pantry area. So again, we're just handing bags out there and you know, following those same practices. We also have 18 additional food distribution sites through our, what we call our conferences, which are like our branches, which are tied to different Catholic churches throughout the county. And so I'm going to give you a few examples of how we do that. But before that, one thing that we started in April of last year, and we are continuing, sadly, because food insecurity is such an issue that we have to continue doing this, but we're able to, is that we do large scale food distributions. And that's anything from 300 to 500 boxes of food plus produce from the food bank, and sometimes with Boy Pony Express as well. And that's a little different animal. that takes some logistical, you know, creativity. And we have Stephen Crank, who is our Vincentian Services Manager. He's the one who really works with all the branches and really manages that. He has taken this on, and, you know, I've gotten out there several times to distribute food, load boxes. We've done them at our facility in Pittsburgh. We do them monthly. We've been doing them monthly at Catholic Charities in Richmond. And we do that on the second Tuesday of the month, and we've got that lined up at least through June of this year. And then we also do it at other locations, depending on the need, depending on the opportunities. We did one in West County back in November in San Pablo when West County was doing their COVID testing and flu shot, and they were able to, you know, do like 600 plus COVID tests and 400 and some flu shots, and we fed about 430 families. So we figured we probably hit, you know, a few thousand people that day with food. So it's, you know, we maintain our social distancing, as you see in the first picture. We need to gather some basic data. So we're doing that mostly for our funders so that we can report back what we're, you know, doing as far as how many, you know, children, families, where they're from. But that's it, just a few basic questions. We also worked with the census when the census was going on, because it was a great opportunity for them to, that's who is in the jean jacket there, is a census worker, but all fully masked, you know, gloves, et cetera. We always provide a lot of PPE available for our volunteers. We have gloves in several sizes. We have different kinds of masks. We have a lot of hand sanitizer. We've been blessed by some donations, but we've also been purchasing stuff, because I never want lack of PPE to be a reason that we can't give out food. So we make it also available to our different branches if they're in need, if their funds are short. some of our branches are in areas maybe don't get as much funding because the churches haven't been able to collect as much funding since COVID and since we haven't been able to go into our houses of worship. So PPE is not stopping us from doing stuff. So anyway, so they gather the basic data and they're asked to open their trunk. And another thing so that to maintain the distancing is that if you've got a larger family that requires, let's say, 2 boxes of food, the person doing the intake will put a sticky note on their windshield with the number of boxes. So that way, the people putting the food in the back don't have to go back up to the person and say, how many boxes, because they do this at one place and then about, 6 feet later, we let them, go through, so we do this for safety reasons as well as for safety from let's not run people over with vehicles to safety of the safe social distancing. So we do that, and then the volunteers place the food and other materials in the car if we have giveaways that day or anything like that. We also have walk up when we do these large scale distributions. You can see that in the bottom slide. We mark the cones and we've got so that's actually the return aisle. The waiting in line is to the far right. You can't see it, but to the right of where the parking stops are. People come up, they come up one at a time to the table, give their basic information, get their food, and then walk back around, between the orange cones and the sidewalk. Again, that's giving them 6 feet from the people who are waiting, but keeping them out of the flow of the traffic as well. So safety all around. So that's how we do the large scale distribution. And then I've got examples of 3 different parishes and how the St. Vincent de Paul branches there have been doing that. So pre-COVID at St. Mary's, it was a great setup. There were always a couple of volunteers inside, and the first one would, just check against the master list if it was somebody who was already registered. If not, they got the ID, took the very basic information. And the neighbors went into the pantry and shopped. I mean, the things were sectioned out, almost like a mini grocery store. But when I say mini, it's mini. So that created quite an issue. But it was nice because it gave, a neighbor who's in need asking for food some empowerment over what they could pick. So that was the good thing. Well, COVID hit. So initially, the president of that conference, just in an abundance of caution and looking out for her volunteers, because of a lot of our volunteers fall into, the age vulnerable ranges, she benched all her volunteers 65 and over. She said, you guys can't even come. I don't care how healthy you are. I don't care who you are. I don't want to be the one responsible. Back then in June, when retail started opening up and we started learning a little bit more about, better practices for social distancing and hygiene and all of that, she let people come back if they wanted to. Some adult children didn't let their older parents come back. So that's been a challenge, but it doesn't, who's ever comfortable, great. And, they're moving forward and getting vaccinated as soon as they're possible. So now what they do for the intake is they put their intake form, which only takes up like half a sheet of paper. Again, it asks for some very basic information. And if they've been there before, they just have to put their name. But then on the bottom, they've done a list of kind of the staples that are always there. And the person gets to circle what they need. And then they always get, depending on who's donated food that day, if it's Trader Joe's, if it's Safeway or whomever, they've got the whiteboard that lists the specials, either something they've got a lot of or something that they got special that day. And then the person gets to write that on their list as well, if they want any of that. So the way they have that, the volunteers then set up, and I'm sorry, let me go back to the beginning. All our volunteers at all of our pantries do temperature checks, as well as all of us at the staff at the offices have a temperature check when they come in or check in or start their volunteer shift. And then they also self-certify that they are symptom-free, and we have them print and sign their name, and we just file those away. And they're all properly masked and gloved, and again, hand sanitizer there for everybody. So that's without exception. And I've gone to different food pantries and I've seen it in action. So, and as well as other people. So it's not just because we're showing up that they do that. So anyway, so they have sanitized clipboards and pens, and they put the intake form on there. And they, again, like I said, they fill it out. Then they turn in the clipboard and it gets set on a table, and they have like 3 stations within the pantry, so that's as close as they can, that's as many as they can have, and still maintain social distancing. And so they shop from the neighbors list, bag the groceries. So they're each assigned to a station. One is in charge of the special stuff, one is in charge of part of the staples, and the other one on the other one. The neighbors can either wait outside while their groceries are being packed, or they can sit in their cars and they'll call them when their groceries are ready. They're then given a sandwich and water on their way out, so they can't be tempted to consume it when they're there on property. And then so other things that they've done at the actual pantry, they have the front and the back door open to get air exchanges in there, which we know is helpful to minimize the spread, as long as we're kind of moving fresh air in, and that's regardless of the weather. And one interesting way that they adapted a little bit was particularly during the summer but even back in March and April, when schools started Zooming and everything, is that they have family volunteering. So it allows for more people to be in the pantry because they're already together at home. So the volunteers, the non-family volunteers, then step back and do the other tasks around either, just coordinating the people or handing out the sandwich or something, and let the families then do the shopping inside. So, it runs a little bit more efficient. And it's a great family opportunity too, to have everyone give back to the community. So that's kind of a nice way to sort of expand your program. So that's one way that they're doing it at St. Mary's. Then we have Most Holy Rosary in Antioch. So pre-COVID, the neighbors would line up outside. They'd go into the pantry to check in at the desk, provide proof of their residency, and then they'd get handed a bag of food and they'd be on their way. Now they have, where they do this from, there are double glass doors. So those stay closed, and they've created like a small box about 2 by 2, 8 feet away from the door, where somebody stands. So that's where the first person in line stands. And then you can see just the tape markings on that first slide behind the lady in the walker and the gentleman with the cart. They're all standing 6 feet apart. They're waiting, the squares off to the right, you can't see it. But they come in, so they come up, and what they do before the line queues up is they put a bag of groceries on, a bag of food on a bench that sits right outside the double glass doors. They open the door slightly when somebody is standing in the box, so they're still more than 6 feet away, and they're all masked. And if somebody comes up that's not masked, they hand them a mask right away, and they ask their name. If they're already in their database, they're told to take your bag of food, and then they come back in a month if they need to. If they're not in the database, all they're doing is then asking their name again so that they actually can log it in, and ask if they live in Antioch. They're not handling any documents. They just make a note that when we can go live again and see people, closer up, then they can just verify. But if somebody is walking up to ask for food, they're just doing this because they're supposed to only help in their community. So that's why they ask. But it's not like they're going to say no to people, and most people won't lie about where they live just to get some food. Anyway, and then they take their bag of food. So the interesting thing, and you were talking about packing the food separately, the food down there, you see the bags of food, and according to the food bank, when they've come to visit the pantry there at Holy Rosary, they have never seen more efficiently packed bags of food. Every square inch is used to its fullest. And the gentleman who is in charge of this is an 85-year-old man who worked in the grocery industry all his life, they have a freestanding shed. He collects the food, he puts it there. He goes to the different other pantries or other churches who have collected food. He's the only one who handles it. No one else is allowed. You never want to get him upset and touch the food, but that's what he does. And he has not stopped,
Wow.
regardless of his age. So I think he's finally gotten vaccinated, though. They at least convinced him to do that. So that's another way that they're doing it. And now the third place that I thought was an interesting way of doing it is Christ the King in Pleasant Hill. They get quite a bit of traffic from the Monument Corridor particularly. And pre-COVID, the neighbors would line up outside their door. They'd come in one at a time, sit in the reception area, register, also bring up if they had any other issues or other needs that the branch might be able to help them with. And while that's happening, they're getting handed food and a food voucher. Now, of course, that stopped. So fortunately, the door to that office, so because people know where they're supposed to go generally, has a window in it. So they come up, they've placed a walkie-talkie in a basket outside there, and they have the neighbor in need take the walkie-talkie, and then there are two other walkie-talkies inside with the volunteers on the intake side and then distribution. So while intake verifies the neighbor's information, and if they're new, they have them, press their documents against the window like we do at our place, so they can fill out things properly. Distribution is generating the food voucher and takes it with a bag of groceries appropriate for the family size and places it on a chair outside the back door to the pantry. So once they're done at the front with the intake and everything, they put the walkie-talkie away, and then the intake person will go out and clean the walkie-talkie, put it back in the basket, and then the next person can come up to the line. Inside, to better protect the staff, they've limited it. So the intake people, they love having husband-wife teams because then they know that they're sharing a shared space already. So they feel more comfortable, or then that they can have two people in distribution and one person in intake if they, to kind of move things along faster. They also upgraded the ventilation system inside the office. It's nice. The current conference president is a mechanical engineer by trade, so he kind of, figured something out. Not everybody has had access to that knowledge, but he did. But one thing they've done. Are they
doing that in their new building?
Yes, they're doing this in the new building. Exactly. Yeah.
So they've got the best ventilation system on the planet already.
So, and they've got, and then Gary added more to it. So venting out from the office space up to an unused bathroom or an unused office or something upstairs. So yeah, he's great. But one thing not having to do with food handling, but just an interesting is they've been blessed with enough funding. So they've been adding money to the food voucher amount or to the number of McDonald's cards that they're able to give to a homeless person. And then, either before they open up to the public or during, if they have a little lull, that's when the groceries are bagged. Or people will actually come in off hours to bag and handle the groceries and have them all ready to go there. So just want to show you a map. All the blue squares are where we have pantries. So this has been going on, and only two shut down since the pandemic. One was our pantry at St. David of Wales in Richmond. And the people who ran it were, in their early 80s and just said, no, we can't do it. So the actual branch there has started figuring out how to do deliveries of food when they're seeing neighbors in need, or set up a small pantry at the church there at St. David of Wales. And so and the other pantry actually had reopened up. So we're fortunate that our volunteers are very creative in how they've adopted to this. Some are doing solely outdoors. Some used to only do outdoors, but now instead of letting people shop, they're placing things, in bags, again, not letting the public and interact with the food, et cetera. So if you want, there's a full list of our pantries, the hours they're open and everything on our website. If you go to svdp-cc.org, and on the front page, it'll say if you need help or see where our branches are located, click here and you'll get a whole spreadsheet with hours and who is a pantry and who's not. And yes, definitely look forward to being more part of the eye care volunteer opportunities, but here to answer any questions as well. Thank you.
Thank you. Does anyone
Should I
have any
jump in, Will?
questions for Claudia? Let's do questions and then the two, we'll pin the two of you. But
Okay.
if anyone has any questions for Claudia, we'll. Okay.
Well, I have a question for Claudia before I go. So Claudia, you talked about the 65 year and older that were benched, and then I mean, did you see a lot of younger people stepping up? I mean, we saw a lot of seniors having to step back, and then some kind of getting back in the game, so to speak. But seniors are so important. But when you saw the void, who helped fill it?
Some of the younger members of the conference started working double shifts, so they got paid twice as a volunteer. Their salary doubled. But yes, we see some. Like, for example, the families at St. Mary's. They've also had opportunities from the different faith formation classes do volunteering things. If nothing else, putting together toiletry kits or putting together things that can be handed out with the food, stuff that maybe the volunteers would have done normally. They've gotten some new members, people who no longer are doing these ridiculous 2-hour commutes and are working from home, all of a sudden find that they could take a gap of time, maybe a longer lunch or a couple of days, a couple hours in the morning or something to help out with the pantries. And then, so that's, we haven't seen as much, but we have seen some. And it's just kind of sporadic, where the challenge has been because the younger population oftentimes is at home helping with the homeschooling or with the Zoom schooling of their kids. So we've had actually people who have kids in Catholic schools or other non-public schools who have gone back to school who are now coming back out. So.
Thank you for that. Thank you.
Yeah, no problem.
It's encouraging.
Yes.
So we're pinned to, should I can jump in and I really appreciate, Claudia, what you shared and the detail and the successes. I wanted to kind of highlight a couple of other stories of what we see going on out there, in addition to the shifts that you talked about on the adapting to COVID. Interfaith Food, we work on food access, which is really a theme of the whole night, but we have a focus on supporting local farmers and getting fresh and local food out there to folks. So what are some examples from that piece of it? The first one I'll talk about is mobile farmers market. There's some of you well, of course, we've all seen a taco truck or food truck. Not too many of us maybe have seen the Freshest Cargo, which is imagine a taco truck that's turned into a farmer's market. They get food from the farmers markets. They're organized by Pacific Coast Farmers Market Association on the 680 corridor. You're home to many of you. And they get great fresh veggies there from the farmers at the markets, and they drive it to different spots. And say, all right, we're going to stay here for an hour, stay here for an hour, stay here for an hour. The one driver drives up, they sell. These are spots in communities where you don't have enough traffic to draw in a bunch of farmers who are going to stay there all day and park their trucks and make it happen, right? And typically, like the Freshest Cargo and does accept different kinds of incentives, so people who don't have money to pay full fare can get a subsidized price. We've also worked with another mobile farmers market, the Ag Institute of Marin, and part of what they've done is said, all right, they really shifted their routes when COVID hit so that they could stop at more senior facilities. And we worked with a couple that, they literally changed the schedule, added new spots, but also for existing or new spots, they said, all right, we're going to set up the lines like we've all seen at grocery stores, tape on the ground, like Claudia talked about, every 6 feet. So seniors are coming up one at a time to get their purchases. They're bagged carefully, everyone's masked, sanitation stations. And this is something it's you can think of it as a pop-up market or a pop-up farmers market. So I wanted to just make sure y'all knew about that. And we've been able to provide subsidies to some of the purchases there. And I think we all know, you know, that with food access, one of the challenges that can happen is there's a lot of ways to put it, but you know, pride. Some people who have food access needs don't want to wait in a line, but if they see that they're purchasing and getting a subsidy, it's a discount price, or they can use a food stamp / CalFresh or SNAP card as one of the ways they're paying. Nobody knows, you know, how they're paying, what kind of card they're using, and then it feels more comfortable. So that's one I wanted to mention.
Steve, can I quick chime in?
Another little story. This is, please. Well, it's okay.
Sorry.
It sounds good to me. We're a small group, informal.
Fresh Approach, we used to have their mobile farmers market at our facility in Pittsburgh a couple times a month.
Okay.
And I don't know if they're operating again.
Actually,
or
Fresh Approach is that truck is called, they call it the Freshest Cargo, I think is the
okay.
Freshest
Yeah,
Approach is
okay.
name. So what do you want to say? What happened to, or why did it stop?
Yeah, are they back operating? Yeah, because we haven't had an opportunity to have them back since the onset of COVID. So, and we had good traffic there because we have the dining room that Loaves and Fishes operates, doing to-go meals 7 days a week now, because people are hungry every day of the week, not just Monday through Friday. And they so they had a great audience there that they could sell to.
So that's a change I haven't heard, Claudia. Loaves and Fishes is now 7 days a week.
Only at 2 locations, at our location and then at their Martinez dining room.
Okay, not all of their locations, but
No,
that's good
not
to
all
know.
the
So we can at least refer folks into Pittsburgh and
Please.
Martinez.
Please, yes.
7 days
And
a
in
week.
Pittsburgh, they're doing, like on Sundays, they'll do more like a brunchy sort of breakfasty food or something like that. So, but they're serving about 200 meals a day out of our dining room, and I think we're the busiest one right now.
That's good to know.
Yeah.
And then they will start
And also
soon serving out of Trinity Center in Walnut Creek, not just for Trinity clients. So that's supposed to launch probably within the next month, if not sooner.
Nice. And I'll say we had a grant previously where we were covering half the price of the purchases from Freshest Cargo spots. So, but I haven't talked to them in a few months. So I'm gonna. It's a good reminder to check back in with those folks. I'll tell another story that may be helpful to folks. I mean, Mercy Retirement and Care Center, they had been bagging all kinds of fruits and vegetables for hundreds of clients a week. They realized that this facility that they were bagging in couldn't accommodate social distancing. So they just up and moved. They found a church that had a social hall that wasn't being used. They were able there to set up long tables, keep everybody 6 feet away, and continue the, bagging the produce and getting it out to folks. So that was a success. And sometimes that's what it takes, is to try. It's not working the way you normal business, move somewhere where it can. And congregations have stepped up to make themselves available. I also heard about a farmer's market that got shut down originally, and a church nearby said, hey, you can use our parking space for your market space. I'm going to build a little bit on what Isai was saying about community supported agriculture and CSA. I mean, CSA is going strong as touchless delivery of boxed veggies to people's homes, long before COVID-19, even before COVID, even before 1999 or 1989. This is a system where, as we talked about, you buy a subscription, you buy a share in a farm, they give you a box of veggies every week. And sometimes that's delivered to the congregation or the church. Sometimes it's delivered to people's homes. Usually there's a little extra fee for that. And sometimes people pick them up at the farm. Well, when COVID-19 hit, as we all know, folks were nervous about going to the supermarkets. more interested in local food system than ever before. What we saw with a lot of CSAs, they just kept doing what they had been doing, and they stepped it up and increased the number of people they were serving. We saw some continue to do programs that do discounts for low income people. But this is not, obviously food access became a challenge for people of all income levels as COVID hit too. And as the demand, the waiting list for CSAs went up, a couple of things happened. One was farmers markets said, hey, we're going to adjust and we're going to make box programs where people can come in, order online, drive through, get a box of produce, put it in the back of their car in touchless delivery of farmers market produce. Something pretty exciting. Some of the congregations we know that were hosting CSAs really kept going the same way they were, and it worked with little adjustment. And like at my congregation, I'll say, the pickup window for the CSA is Wednesdays from 2 to 5 p.m. The farm drops them off at 1 p.m. People can pick up anytime during that time. So it's really been social distancing for many years. I want to say, what's the future? I mean, as Will says, people are getting vaccinations. We're looking to a time of herd immunity, as they say. But in the meantime, and even then, a lot of folks are going to be very cautious about all of this. I want to tell one little story about CSA and not social distancing, which is Temple Isaiah and Our Savior's Lutheran Church. And there was a third congregation that had a CSA going where this, people would come pick up their boxes at the synagogue there, and someone said, we need to see how efficient this is. And they checked, and it took people 5 minutes to drive up, get their box of vegetables, and go home, right? And they checked again about 3 months later. And you know what was happening? It was 35 minutes. So why did it take so much longer? Was it a good thing or a bad thing? In that case, it was a very good thing, because what was happening was people were getting out of their cars, talking about what they were doing. They're talking about a recipe they used for the kale or the kohlrabi or the tomatoes, talking about, they were sharing recipes. They were building community across faith lines and in person. We're not ready to see that, but as 6 months from now, some of you will be going back to doing more food fairs and cooking demonstrations that combine and at a garden or a tasting or a visit to your garden. All of these food safety issues, questions that we've been talking about today are going to still be very relevant, and we want to help you think them through. So I just want to put that out there. We've done a lot of talking. We should get some questions and answers. I just wanted to say, Interfaith Food, we're not a huge shop, and actually Stephanie, Laura, and Isai are all new in the last 3 months, and this is the first presentation they ever did for us. So great job, guys. Thank you. I'll just add that anybody on the phone who wants to move any of these projects forward or talk about it, we're happy to be part of planning meetings or planning assistance, technical assistance, or come back one-on-one with folks from your congregation, and we want to keep going. So that's all I've got. Let's see what the Q&A is, if any.
And maybe Laura can put up the contact information one more time for Interfaith Sustainable Food Collaborative. And let's move to gallery view. And is there any questions? We're almost done with our time tonight. Thanks so much for sticking with us. Judith?
If you can put in the chat the sustainable food contact information. I did get the 10 euro, but like the phone number would be helpful, because I can copy that and put it in my own doc.
Sure thing. And of course, we want to remind you that we're really going to be continuing the conversation around pandemic EBT when we come back together a month from today at 7 o'clock. It's your same link. We'll also record it and put it on our YouTube channel for those that are studying this. But we want congregations to start thinking about how are you going to start serving the people that are hungry and maybe living without shelter in the coming months. So that's one of the reasons why we wanted to do this, so that you can start having the conversations in your congregation now. And if we can be helpful for you with iCare, let us know how we can partner you with another congregation in your own region or not. And we also have groups and clusters in South County, West County, East County, Central County, a couple clusters in Central County, in Pleasant Hill and Walnut Creek, that are already doing some programming together. And so the more we can work together, the more we'll be able to see these needs met.
We're a small and primarily aged congregation, and our denomination has shut down all the buildings. We're not even allowed to meet outdoors. We just have one or two people who go in for a little bit of maintenance.
Can I ask
and
which
we kept our cleaning
Judith?
person. Community of Christ.
Okay.
We're in 2nd Avenue there in Walnut Creek near Maine and
That's right.
Buena Vista.
Oh, okay.
So we
So you're being very
have
careful.
had a little bit of gardening. There might be the future for doing community gardening. Right now it's been one gentleman in our congregation, and we've shared a little bit with Trinity in the past. And we don't have a commercial kitchen. We
But you have a really nice space.
we did get it.
You have a really nice remodeled space.
Yeah. But we do host one weekend the winter shelter for that Trinity Center is involved with the logistics for. And so we got a dispensation to do that again, fortunately, because Trinity has it so well organized that it doesn't require any of us to be involved.
That's
we just
great.
give them the key.
And I think the phone number, it's Laura. You know, there's an email on your screen, but the phone number for the Interfaith Sustainable Food Collaborative is 707-634-4672. If you need to get a hold of the Interfaith Council, right now the mobile number for the Interfaith Council is 925-933-6030. And we're so grateful that you joined us tonight. And if you want to invite some more folks for next time, you want to give them a teaser about pandemic EBT, Steve?
Sure. Well, Pandemic EBT is a new program. It's like CalFresh or like SNAP. It helps low-income people get a card that they can go use at the farmer's market or online purchases at Walmart or Safeway, wherever they might go. It's really there to replace the food that kids that are low income were getting at school. Now they're not going to school. They're not getting those school lunches, right? But what's interesting about PEBT, it's also undocumented people are eligible. And a lot of them didn't know they were eligible or were concerned about getting in. So it's really important that they hear from trusted sources, churches and other faith groups that, hey, this is a program you can take advantage of and you deserve to. So there's going to be a new round of funding coming out. It's used to be kids like 5 years up, and now it's going to include 3-year-olds, 4-year-olds, a new group of folks. How do people get those cards? How do they make sure they're getting the benefits? This workshop is going to help congregations know how to get the word out, what we can do to help get the word out to people so we don't leave literally millions of dollars on the table for low-income people who need it.
So true. The need is huge. The calling is great, folks. Let's do it together. And if you want to get a hold of Greg, give folks your email.
It's Interfaith Greg K @gmail.com.
Thanks, Greg, for all you do in organizing all of our eye care groups. And I'm sure Claudia is going to give you a call or an email soon. I'm sure we'll be getting some congregations working at St. Vincent de Paul together soon.
I'm excited about that.
Thanks again, folks. Thanks for being here. Thanks for all of the presenters tonight. And we have participants from Central to East County. So it's been a great night, and we appreciate you and your presence. And we're so grateful that we can start this conversation and share it online. And if folks need any more, you just back up a little bit and you can get all those phone numbers and emails. All the contact information is there. So thanks again to Claudia from St. Vincent de Paul, and Steve, Stephanie, Laura, and Isai from the Interfaith Sustainable Food Collaborative. So grateful to be able to work with you again. And we'll see you next month, March 3rd. Be well.
Thank you.
Y'all.
Thank
You
you
all.
all.
Thank you.